So I'm up early with the pups. 5:30 is usually their get-up time. And I wanted to give you an update on Astrid. So she's been on anti-inflammatory pain meds now for 3 days. I gave her a half a dose last night because I'm trying to see how she's progressing. And she did come out here when she heard the husky behind us barking, and she came out here and had a barking fit, and I had to basically drag her back in because I don't want her, straining her muscles. I don't know exactly what she pulled, but I think it's probably in the front legs. There's nothing serious. She walks, and she ran up to the house, but I'm trying to keep her from doing that. So I only gave her a half a pill last night, and she did come out. She sleeps all night really good, and she came out, went potty this morning, and went back in. So she'll be doing fine. I just want to take it slow with her. I don't want her tearing anything or hurting anything. But she's eating good, and the pain pills are working, and the anti-inflammatories are working. So that's all good news. It's been hard. It's been hard for me with my Astrid. But we got a lot of new dogs in at the rescue, and Lisa and I have been going out every couple of days and meeting them and taking pictures and doing videos. So hopefully most of them can go on this next transport to Virginia. And the puppies have not gotten any apps. Their sister Harper is adopted, and their brother Mateo, the white one with the blue eyes, got adopted. And I kind of figured that the little brown dogs would be a little harder, which is why I took them, because I didn't want them out there. But they are getting really big, and they're really fun, really smart. It just takes a little longer to get brown, big dogs adopted. It's just the way it is. I mean, look at Astrid. She's had one app in a year. So, and of course, we're not just going to hand them over to anybody. So, they'll be fine here. If they get a little too big, or they get a little too antisocial for whatever reason, because I'm pretty much in a bubble here, I may take them back out to the rescue and let them learn how to get along with other dogs and other people. I hope I don't have to do that. I very rarely would do that, but I would do that with these puppies only because they need a lot of social exposure other than what I'm going to be able to give them. They need to be around other dogs. They need to be in different play groups. They need to be around different people. So if they don't get adopted within the next couple of months, then I'll probably take them out there, let them learn to get along with other dogs, learn other social skills, see other faces, other people. And I think that's going to give them a better chance to be just good all-around puppies in the big picture. So that's kind of what I'm planning. I don't think I'm going to have to do that, and I would rather not, but it would be best for them overall. Yes, because they're my sweet babies. They're so smart, and they know how to sit, and they're just happy, happy puppies, and I want to keep it that way. I want them to have every opportunity, just be well-rounded, good dogs, and go to good families. Look at them. I did a whole bunch of new pictures and a lot of new videos. I may update them since they have doubled in size since they were posted. I think they're going to probably be 50, 60-pound dogs, just based on how much they have grown in the last 2 to 3 weeks. They're going to go get their neuter surgery on Saturday, so I'll get up-to-date weights. But Mateo, he's a little smaller than they are. He was 17 pounds like a week ago, so I'm pretty sure these babies are going to be pushing 20 pounds by next Saturday. We just big, happy, goofy puppies. Yes, and we do head tilts. Yes, we do head tilts. Also, I wanted to let y'all know something else that was kind of happening I mean, listen, I don't like to go. Rescue is not easy, okay? It's not just about saving the dogs, which, yes, that's what it's about for us. There's a lot of legal things we have to do, a lot of things to keep our nonprofit straight, keeping up with donations, etc., etc. We have insurance policies. There's things we have to have in place to really do it right. Plus, we're the only ones that test for Chagas disease and treat Chagas disease in our dogs. But on top of that, we had about 2 months ago, we had one of the dogs that we got in from the hoarder. His name is Oscar, and he's a little scaredy cat, but he's super nice. I mean, he's always been nice with us, and the people understood that, so they picked him up with foster to adopt. They were told numerous times, he's only 10 pounds. You pick him up in the kennel and take him in your house in the kennel. He is not leash trained. He'll get scared. He'll freak out. He came from a house with 75 dogs. And so guess what happens? They drive like 15 minutes from the rescue, and apparently he had a bowel movement in the kennel, which is normal. I drive around smelling poop all the time. You clean it up when you get to your destination. You don't pull dogs out on the highway to clean a kennel. Well, that's what they did. They pulled him out on the highway. He almost got loose because they didn't use a slip leash on the highway at a gas station. And when she tried to grab him, he bit her. He nipped at her. I didn't see it. I don't know how bad it was, but, they brought him back immediately. And, they said, we understand what we did was wrong, the husband. And, sorry we did it, and blah, blah, blah. So no matter how you tell people how to handle dogs, they just think they know better, and they don't listen. So what happens a month later? They're suing us. And although we have everything in writing, we have documentation, we would have gladly paid their, hospital bill or their deductible. I mean, even though it wouldn't have been our fault, we would have helped them with that. We would have paid for it. And no, they went and got an ambulance chaser lawyer, and they sued us. So I'm in the middle of having to handle that. Where'd the puppies go? And, I've talked to the insurance company, and